That will help us to, will allow us to continue to remove public health measures, and it will do that while also achieving immunity without the increased risks associated with infection, which includes severe illness, hospitalization, death, and long COVID. Having said that, the increased transmissibility of Omicron and the surge in cases do mean that we need to continue to adapt our response and how we manage. And we acknowledge at this time that the return to in-person learning might come with mixed feelings for students, parents, and staff because of all of these changes. Tonight, we'll look at how updated guidance on testing and case and contact management affects schools, and we'll answer as many questions as we can. And I'll say we have received many questions ahead of time. And we'll begin with those, and then we'll go on to some questions in the comments. First, I'll turn it over to my colleagues to introduce themselves. Dr. Hayward?
Thanks, Dr. Clausen, and good evening, everybody. As Dr. Clausen had mentioned earlier, I'm Dr. Lauren Hayward, and in addition to being the physician consultant with Huron Perth Public Health, I'm also a family physician in North Perth. Also, I'm the mom of 2 young kids, one of whom is in elementary school, and so I can understand parents' concerns about the health and safety in schools during the pandemic. Over to you, Dr. Walsh.
Thanks, Dr. Hayward. Good evening, everybody. I'm Lisa Walsh. I am the Director of Education for the Avalon-Maitland District School Board. These past 2 years have been a huge challenge for all of us, and I'm really happy to be here tonight to tell you what we know now. I work really every day with the senior staff, who are the superintendents of our board, principals, system managers, and our staff to address all of the issues and changes in the health and safety protocols to keep both staff and students healthy. Our primary goal during this pandemic is to keep students well, engaged, and learning with their peers and their teachers. And I greatly appreciate parents working alongside us to fulfill the obligations directed by the Ministry of Education. And over to you, Mr. Rourke.
Thank you, Dr. Walsh. Good evening, everyone, and welcome to the call. My name is Chris Rarig. I'm the Director of Education at the Huron Perth Catholic District School Board, and thanks for joining us this evening, and thanks for everyone who submitted questions in advance. I'd like to share a sentiment of gratitude to the whole community for your flexibility, encouragement, and compassion as we work together to keep our schools open. And back to you, Dr. Clausen.
Thank you. So I'll start with some of the common questions and themes that we received ahead of time. Question number 1. So kids are back in school and we don't have access to testing and won't be notified if there are cases in the classrooms anymore. How will we know if COVID-19 is spreading in schools? So I think it's important to start with the fact that Omicron is widespread in our communities. Whether we detect lab-confirmed cases in any given setting, including in schools, or not, may be misleading. And this has been a concern of mine all through the pandemic, is that people pay too much attention to where cases have been confirmed. And by the time we receive that lab report, the window for spread has already occurred. It's too late. So at this time, as always, it's recommended to assume that everyone with whom we come into contact at all times and in all settings could be infected with COVID-19. And we should always pay careful attention to public health measures, such as masking and distancing, wherever we are. Schools have many layers of public health measures in place, which limit the transmission of COVID in the school setting. This is similar to how we manage other respiratory infections, such as influenza and RSV. People are encouraged to stay home when they're ill to prevent spread to others, and people are encouraged to seek medical care only if their symptoms do not resolve or become severe. The majority of people will recover without incident. If you have symptoms of COVID-19, assume that you have the virus and may be contagious. You don't need a test to confirm you're infected. Lab-based testing is targeted to the highest risk settings in individuals at this time. What that means is that public health is no longer aware of every lab-confirmed or probable case or a symptomatic person, or whether they've been at school when they were infectious. It's important to remember that schools are not among the highest risk settings for transmission, as public health measures have been effective in limiting spread in schools. Transmission in schools has been generally less than in the community. In most instances where there is a case in a school, there will not be high-risk contacts as long as all public health measures are being followed. Therefore, where there are cases in students or staff, the public health management would not change. All students and staff, unless they're specifically identified by a case as being a high-risk contact to the case, but otherwise all students and staff are advised to self-monitor for symptoms, screen daily before attending school, follow all public health measures, and if symptoms develop, self-isolate in accordance with provincial guidance. In the event that a student or staff is identified as a high-risk contact by a case, and that is due to a prolonged, unprotected, close interaction where public health measures were not being followed, and that could be in the school setting or out of the school setting, then the high-risk contact should follow the ministry guidance, and that depends on vaccination status. In general, for non-household close contacts, if you're vaccinated and you are asked to self-isolate, and if you're unvaccinated, you will be asked to self-isolate, and if you're vaccinated, you will be asked to self-monitor. More details, including the definition of a high-risk close contact and the length of time to self-isolate, can be found at Ontario site, www.ontario.ca/exposed. In addition, students will be supplied with rapid antigen tests to use when they are symptomatic. Anyone with COVID-19, and this is a confirmed case based on PCR rapid molecular testing, a positive rapid antigen test, or someone who is presumed to be positive based on their symptoms, should notify their high-risk contacts of their exposure. And again, more details on around how to know if something is a high-risk exposure and how and when to isolate can be found at that Ontario Exposed website. Finally, it's important to note that in detecting cases in a school, that doesn't mean that transmission occurred in the school setting. In Huron Perth, the majority of school-related cases up to the end of 2021 acquired their infection in the community. Because of all the prevention measures in place in schools, transmission in the school setting has been low. I'll now pass it on to Dr. Hayward.
Thank you, Dr. Clausen. District School Board and Huron Perth Public Health consider taking it upon themselves to report on case numbers and levels of absenteeism in the area schools so parents can check daily and make informed decisions. Being aware on a class-by-class level would be even better. The current proposal from the government that levels won't be reported until there's an astonishing 30% absenteeism level at a school is not acceptable. Nor is the naive suggestion that parents rely on word of mouth from other parents. There needs to be verified information provided daily from the schools and health board. So thank you for this question. Because Omicron spreads so quickly, even aggressive testing and case and contact follow-up is no longer an effective strategy. The cases can spread more quickly than we're able to test for them. Lab-based testing and case and contact management are focused on the highest risk settings and people, including long-term care and retirement homes, hospitals, and some congregate living settings. This approach is similar to how we manage other respiratory viruses like annual influenza, RSV, or rhinovirus. However, COVID-19 remains a respiratory virus that needs to be controlled as much as possible since we are still in a pandemic. And at this point in the pandemic, we're transitioning to a high-risk response. And in view of high rates of community transmission, Huron Perth Public Health recommendations are the same whether there's 10 or 20 or 30% absenteeism. Each person is urged to behave as though they themselves or someone else can be unknowingly infected and capable of infecting others. And as if everyone you encounter in the same vein could be infected and capable of transmitting infection. If we all behave that way and pay close attention to our public health measures, then transmission will be minimized in the school settings and in other settings, and staff and student absences will be minimized and schools can thus stay open. Schools will no longer be routinely notifying students and families of a positive case or a symptomatic student or staff. As mentioned, a case should notify their high-risk contacts. In terms of dismissing cohorts, Huron Perth Public Health will no longer be dismissing cohorts. Specific individuals within cohorts may be identified by the case as close contacts based on their prolonged, unprotected, close interactions with the case. However, the rest of the cohort would not be considered close contacts. In general, Any dismissals or closures of a school will be based on operational requirements. For example, if there are staffing shortages, to be determined by the school and/or the school board. In accordance with Ministry of Education direction, we will inform families when all-cause absenteeism reaches 30%. Do keep in mind that this will include all illness, individuals who may be isolating as high-risk contacts, and people who are impacted by weather, by transportation, or personal or family issues such as appointments. It will be an opportunity to reinforce public health measures for families and schools. We know that Omicron is more transmissible than previous variants, and that is why the provincial government introduced additional measures in a number of settings, including in schools, to reduce spread. Parents will also be able to view the daily absence reporting for schools on the Ontario website soon. Back to you, Dr. Claassen.
Thank you. The next question is, if we can't get tested, how is it practical to stay home every time someone feels sick? It could be many other things. You are correct that at this time, there will be instances where symptomatic students and staff who do not actually have COVID-19 infection will be required to self-isolate, as testing to rule out COVID-19 is limited. This is a necessary measure at this time to protect against COVID transmission in our schools. There are other respiratory viruses circulating, but I will say that Omicron is outcompeting these for the most part. So if you're having respiratory symptoms, it's far more likely Omicron than other viruses. In addition, students will be supplied with rapid antigen tests to use when they are symptomatic. One positive result is considered positive for COVID-19. You can take that as confirming COVID. 2 negative results separated by at least 24 hours may be considered negative. As a reminder though, even with 2 negative results, students and staff should stay home until symptom resolution, 24 hours for respiratory symptoms and 48 hours for gastro symptoms. At all times, if you have symptoms of COVID-19, assume that you may have the virus and may be contagious. You don't need a test to confirm that you're infected. If you think that you have COVID-19 or were exposed to the virus, please visit ontario.ca/exposed and follow the isolation and or self-monitoring guidelines to take care of yourselves and protect others. Also follow the directions on the school screening tool to help determine whether your child can attend school. Public health's advice has always been to stay home when sick. If symptoms are not consistent with COVID, the ill individual should stay home until their symptoms have been improving, as we said, for 24 hours for respiratory symptoms or 48 hours for gastrointestinal symptoms like nausea, vomiting, or diarrhea. Back to you, Dr. Hayward.
Thanks again, Dr. Claassen. So our next question. My question is about older citizens who may be watching kids as daycare before and after school. How do we know if we are safe if you are not telling us how many COVID-related cases are in the school, let alone in the class our grandchildren are in? How do we keep ourselves safe? And how do you know whether the self-assessment every day is even being done by all? Do you require proof that it is being done? So there is a high transmission of Omicron within our communities, and there are ways that all of us can reduce our risk of exposure to COVID-19. These include wearing a well-fitted mask in indoor public spaces and any time that physical distancing can be a challenge, limiting close contacts and interactions, maintaining a distance of 2 meters, called physical distancing, of course, from those who are not in your household. Wash your hands often with soap and water or an alcohol-based hand sanitizer. Screen yourself every day before going to work, school, or childcare. Stay home if you are sick, even if your symptoms are mild. Follow gathering limits. Get vaccinated as soon as you are able, and take every dose for which you are eligible and as soon as you are able and with the product that is available. There are many measures in place in schools to prevent COVID-19 transmission, such as wearing masks, cohorting, restrictions on extracurricular activities, improved ventilation, enhanced cleaning, and mandatory self-screening. All staff, students, and visitors to the school must complete the screening tool every day before they attend. At this time, the province has directed that schools must confirm completion of the screening at the start of the school day or before entering. If you are providing daycare, I would recommend that you also screen the children for which you provide daycare each day. The school boards can explain the process they are using to confirm that daily screening is being completed. I'll turn it over to you, Dr. Walsh.
Thanks, Dr. Hayward. So students from grades 7 to 12 can complete the Ontario Health Screening Tool on their personal device. And then what they need to do is when they come to school, show that pass to their classroom teacher or an educational assistant. If they cannot, if they don't have a personal device, they can do a paper copy of the screening, and there will also be additional copies available in the classroom. Parents and guardians of younger children, so kindergarten to grade 6, these students are asked, or the parents are asked to complete the confirmation process by completing the Ontario School Screening Tool and either filling out an online and or marking their initials on a paper health screening log that's returned in the student's backpack each day. I should note that parents and guardians of students in grade 4 to 6 are asked to complete the confirmation. But if you were to forget, students are also able to complete the form if they can understand the screening questions with their classroom teacher. Any parents and guardians without access to the online Ontario Screening Tool will be provided a paper copy to complete and return with the health screening log. The screening tool is available in English and other languages are coming soon. And it can be downloaded from the Ontario School Learning page. And none of this student data will be kept.
The next question is about symptoms and isolation. Is my child okay to return to school if all they have is a runny nose? If household members are isolating due to symptoms, but my children don't have any symptoms, when can they safely return to school? So it's going to take everybody to be very flexible and patient and diligent, and we know it's complicated. But at this time of the Omicron pandemic, it's really important that we pay attention to all symptoms, even minor ones. So if the child's only symptom is a runny nose, which is not related to seasonal allergies, being outside in cold weather, or other known causes or conditions they have, they must stay home until the runny nose has been improving for at least 24 hours. If one household member has symptoms consistent with COVID-19, and again, let's remember that that means one new or worsening symptom on the primary symptom list with things like cough and fever, shortness of breath, inability to smell or taste, or two new or worsening symptoms on the secondary symptom list with things like runny nose and sore throat, and there are other symptoms. In that case, they must isolate for 5 days if they are fully vaccinated and otherwise healthy or under 12 years of age, or 10 days if they're not fully vaccinated or immunocompromised. And all household members of the individual with the COVID symptoms, regardless of vaccination status, should self-isolate for the same duration as the individual with COVID symptoms. Directions for isolation and flowcharts to help you understand this are available at the ontario.ca exposed website. Dr. Hayward?
So the next question is, how sick are children getting from Omicron? There is evidence that Omicron may cause lower disease severity for both vaccinated and unvaccinated children, and also that 2 doses of vaccine provides good protection against severe outcomes like hospitalization. And I will add that 3 doses of vaccine are even better to boost immunity up. And for most children, the risk of severe disease is low, but hospitalization is possible in children, especially among those with risk factors such as age under 5 and even more so age under 2, medical comorbidities, those who are unvaccinated, those who have lower socioeconomic status and other risk factors. And also, Ontarians aged 18 years appear to be at a low risk of hospitalization and severe disease from Omicron compared to other ages. And also, the short and long-term health risks associated with Omicron in children are emerging and should be carefully monitored. COVID-19 vaccines reduce the risk of serious illness and long-term side effects in kids. Vaccines also reduce their risk of transmitting COVID-19 to others. Early estimates of Omicron severity in Ontario, based on a matched cohort study of cases occurring between November and December, there's going to be a link posted for that, and that does show some of the data on severity in youth. So you can have a look at that. I'll turn it back to you, Dr. Clausen.
Thanks. The next question is, why have you just now made masks mandatory for kindergarten students? Well, I'd like to start by saying that, I hear from parents who have been asking for this for a very long time and have been wanting masks for all students and have been wanting other additional measures. And I hear from parents and families who want less public health measures and think that we're doing too much. And I just want to start by saying that, everybody is doing their best. And I think that all families are making decisions, taking into consideration all the information, and they love their children and want to make the best decision possible. And I will also say that, in my role as medical officer of health, I take this very seriously. And in the discussions that I'm at all levels, provincial and municipal and local and regional levels, people are trying to find the right balance when making these decisions. And they're not always that easy. So with that background context about, what a challenging time this is and how everybody is trying to find their way, I'll add that, students in grade 1 to 12 are already required to wear a face mask indoors, at school, and on school transportation. And it was hard at first, but people have gotten accustomed to it. And for the most part, it goes very well. And previously, kindergarten students were already strongly encouraged to wear a mask or face covering, and many did. But we had not mandated masks for kindergarten students previously in Huron Perth, like in some regions. But I can tell you that in some regions they did. And again, it can take some time to learn that, but it has worked. Now, at this point in time, with the very much increased transmissibility of Omicron, the risks of kindergarten students not wearing masks outweigh the benefits of non-mask use. And this added measure will help to further protect both staff and students and reduce the chance of school closures. It is our goal to keep students in the classroom. And Ontario is further strengthening public health measures in schools at this time. And one of those measures includes the provision of quality 3-layer masks for students. So they are going to be readily available for our kindergarten students as well as everybody. And that's why at this time, Huron Perth Public Health is now also requiring masks for students in kindergarten. And we have sent information about this new requirement to the school boards and private schools to share with families. Most young children have become familiar with mask wearing. They've seen it in their community. They perhaps have also worn masks when out in the community. And so given that schools can provide quality masks to all students, this is another additional measure that can be implemented to decrease the risk of Omicron transmission, particularly among kindergarten students who may not yet be fully vaccinated. And I'm often asked, well, how can that make a difference if people have to remove their mask to eat? Well, we're in the school for many hours, and the masks are removed just for a short time to eat. So it does decrease risk, absolutely. And all of these measures need to be seen as working together. There's no one measure that's perfect, but as we add more layers of protection, we help our schools be more successful in decreasing transmission. And I think, Dr. Walsh, over to you.
Thanks, Dr. Clausen. The next question is, are there ways in which the air quality in classrooms are being addressed? If not, what can parents do to improve the situation? Is every classroom getting a HEPA filtration unit? Well, HVAC and the MERV 13 filters that our systems use are really what provides the fresh air. They pull fresh air into the building throughout the day, and these filters are the gold standard in ventilation. School boards were not provided with enough HEPA filter units to put into every classroom, and not all schools need them. As mentioned, schools in the Huron and Perth area have MERV 13 filters in our HVAC units. So HEPA filters have been allocated in situations where the HVAC does not have any fresh air exchanges. Boards have added HEPA units in all kindergarten classes because up until now, students haven't been wearing masks in those classes as per the provincial direction in September of 2021. And Dr. Clausen, I think you're going to add to this.
Yeah, so we get a lot of questions about how COVID is spread, and that's important to inform the decision about ventilation and filtration. So as background, like most respiratory pathogens, the COVID-19 virus transmission is on a continuum consisting of predominantly droplet spread and, less importantly, airborne spread. COVID most frequently and easily transmits at short range through exposure to respiratory particles that range in size from the large droplets, so that droplet spread, which fall quickly to the ground, to smaller droplets known as aerosols, which can remain suspended in the air, but they play a smaller role. Ventilation, airflow, and forceful expulsion, so things like sneezing and coughing, can make respiratory particles travel further than 2 meters through momentum. So again, that's why screening is very important. We don't want people that are having symptoms like sneezing or coughing to come to school. High temperature and low humidity also contributes to shrinking of droplets such that they may stay suspended in the air longer. Transmission of COVID-19 over longer distances, so more than 2 meters, and for longer periods of time, occurs through that inhalation of aerosol, and it's limited really to favorable circumstances. So that plays a bigger role in, for example, in healthcare settings where what's called aerosolizing procedures are being performed, and where there are prolonged exposures in inadequately ventilated spaces where there are people with high viral loads, so people who are symptomatic, who haven't been screened, and where there's lack of masking. So it's really recommended to avoid the 3 C's: closed spaces, crowded places, and close contact, and ensure adequate ventilation, filtration, and masking. That's just a little background about how COVID-19 really spreads. And I think that someone is going to show that Swiss cheese graphic of public health measures. So key measures to reduce transmission risk include limiting contacts, screening, self-isolation of people with symptoms, physical distancing, hand hygiene, and masking, which provides source control, and improving indoor air quality through ventilation and filtration also supports, decreases the risk of COVID transmission by removing and diluting virus-laden particles from indoor air. So the public health mandate does not generally include inspections of and/or recommendations regarding HVAC systems. However, I can say that ventilation, which is bringing in clean air, and filtration, which is cleaning air that is already there, are not sufficient on their own to control the risk of COVID-19 transmission, especially where there are close contact exposures. However, well-functioning HVAC systems that work to remove and dilute aerosols will be part of mitigating against COVID transmission. So they're important for overall indoor air quality and comfort within the indoor space you're in, as well as COVID-19 risk reduction. But very importantly, ventilation and filtration must be used with all other public health measures to minimize transmission. Dr. Hayward?
Thanks, Dr. Clausen. So the next question, will you be setting up in-school vaccination clinics during class time in Huron and Perth? So let's go over some background context first here. As of January 17th, 278,959 COVID-19 vaccine doses have been administered in Huron and Perth. 84% of residents aged 5 and older have had at least 1 dose of vaccine, and 79% are fully vaccinated with 2 doses. In addition, nearly 53% of residents aged 18 and older have had 3 doses. 45.5% of children aged 5 to 11 have initiated their vaccine series in Huron and Perth. And vaccine uptake in this age group has stalled at about 50% across the province. Efforts are ongoing to address any issues, which include vaccine confidence, so addressing questions about safety and effectiveness, and also vaccine access, so ensuring that everyone can receive a vaccine if they want to. Huron Perth Public Health continues to provide information and answer questions about vaccine safety and effectiveness. And we encourage families to speak with your healthcare provider and encourage families to access the Sick Kids COVID-19 Vaccine Consult Service. This consult service is a by-appointment phone service that provides a safe, judgment-free space to have an open conversation about the COVID-19 vaccines for children and youth. It is available in multiple languages using over-the-phone language interpretation. Huron Perth Public Health will continue to work at ensuring that everyone has access to a vaccine. We currently have much excess capacity with clinic appointments available within days and walk-in opportunities as well. Therefore, we are transitioning back to mobile mass vaccine clinics in more communities across Huron and Perth. Huron Perth Public Health and the school boards are working together on a plan for school-based vaccination clinics where feasible, and will take into consideration that there is sufficient interest, that there is a suitable space where vaccine can be provided safely with infection prevention and control measures in place, that there's parental consent to vaccinate children without a parent in attendance, and also children must be able and ready to cooperate voluntarily with a vaccine receipt. So staff cannot compel or force young children to be vaccinated. Parents still have the option of attending a mass vaccination clinic, primary care office, or a pharmacy as well. I'll turn it over to you, Dr. Walsh.
Going to be sending home a survey, and the purpose of the survey is to understand where and if vaccination clinics in schools are required. Thank you. Mr. Bart.
Okay, so this question is for mental health concerns, and many parents feel their children are having with too few outlets amidst the pandemic. At the high school level, or any level, honestly, what do you have across the board for immediate mental health supports? Where would you direct a teen at one of your schools or a younger child and family right now, knowing that there are healthcare shortages everywhere? On any given day, what supports can a family immediately access when needing it, whether in class or online? What has been adjusted in a school day, the school day's routine, that mental health and well-being are a more direct focus each and every day? So an excellent question. So the first thing I would just say is that given the variation in mental health needs, it's always advisable to seek professional help if you suspect a student or a child may be experiencing mental health issues. Calling 211 can be helpful in accessing community support. And students or parents are encouraged to contact the teacher, or in the secondary school case, a guidance counselor and or the school principal regarding access to mental health supports in schools. The short strokes are that districts have social workers and other paraprofessionals that may be of assistance. District plans include services for all students, such as mental health promotion across all schools, preventative services or interventions for students at risk, and specialized services for students in crisis. The two districts' mental health plans are posted on the board's websites, and so you can get a sense of the tiered approach for both of those school districts. And over to you, Dr. Klassen.
Thank you. The next question is, what metric would be used to assess if future school shutdowns are needed, if any? So the Ministry of Education, in consultation with the Chief Medical Officer of Health, makes decisions about school closures and provides directions to schools and school boards with regard to COVID-19 measures at the provincial level. Having said that, at all times, the health unit is required to respond to the local situation and has the authority and mandate to direct additional measures if local epidemiology would support such action. School closures to in-person learning are not recommended as a primary public health measure used for pandemic control. It is preferable to use community-based public health measures, such as indoor capacity restrictions, to reduce community transmission and thus the risk of transmission in schools. And evidence has shown that school closures have not impacted, have not contributed much to controlling community transmission. So we believe that schools should be one of the last things to close and first things to reopen. In-person learning remains the best choice for healthy child development. We all know, I'm sure everyone on this call understands, that school closures can negatively affect children and families and are associated with substantial harms related to mental health and educational achievement, and affect some families more than others due to factors such as income loss and childcare gaps. Lowering community transmission of COVID-19 will help to keep schools open. We can all do our part by continuing to follow public health measures that prevent the virus from spreading. My recommendation is to continue to take small steps as part of a gradual transition from pandemic toward an endemic state, during which time, after each change, we continue to measure indicators such as hospital and healthcare capacity. Right now, our hospitals still have elective surgeries on hold while they are completely full with COVID patients. And we would like to see our hospitals and the rest of our healthcare system get back to full function. We'll monitor percent positivity. And in Ontario right now, there are some hopeful signs that the percent test positivity is plateauing and even coming down. We'll monitor outbreaks in the highest risk congregate settings, such as long-term care, retirement home, correctional facilities, and international agri-worker housing settings. And then we'll adjust our response accordingly. We'll maintain some public health measures to try and mitigate against avoidable COVID-19 infections. So we're doing this in this slow stepwise fashion is what I'm hoping. And that during that time, we continue to administer vaccines. And again, vaccines are our most effective tool in preventing infection, but especially preventing severe outcomes. And that will allow us to continue to loosen public health measures, and that will help us achieve immunity without the increased risks associated with infection, which can include severe illness, hospitalization, death, and long COVID. Back to you, Mr. Rorig.
Thank you, Dr. Klassen. So the tail end of the answer to this is regarding what would precipitate closures. So given the increased sensitivity of the updated COVID-19 screener, we expect that student and staff absent rates to rise over the short term. And we expect that that combination of increased absences and a shortage of supply staff will lead to staffing pressures. So staffing shortages may cause bus route cancellations, cohort dismissals, class closures, as well as possibly school closures. But I would like to just say that will be an absolute last resort, and school districts will do whatever possible to staff school or classrooms so that they're safe, so that they will not close. Over to you, Dr. Walsh.
Required to get their vaccinations and boosters, and if not, how are you ensuring safety? So it's important.
Sorry, can you were cut off at the beginning, so we couldn't hear the start of the question. Could you repeat the question?
Sure. The question is, have all teachers been required to get their vaccinations and boosters? And if not, how are you ensuring safety? So all employees are required to be fully vaccinated, which is still 2 doses, or to complete mandatory training alongside routine rapid testing, which is 3 times per week. Vaccination rates for staff are published on our board website. And for AMDSB, it's over 95% of our staff that are fully vaccinated. Boosters are not required at this time, but they are strongly recommended. And districts are both collecting booster dose vaccination information from our employees at the direction of the Ministry of Education. Staff are also expected to provide evidence of daily screening. This includes bus drivers and occasional staff. And all staff model what it is that the student have to follow, the protocols in place, including wearing medical masks or N95 masks, eye protection, and or eye screens when working closely with the student. Thank you. Mr. Roy.
Okay, the next question. Given that one of the times of the day when students will have their masks off indoors is at lunchtime and sometimes in a cafeteria, what particular instruction and supervision are students being given in minimizing risk, such as positioning students 6 feet apart, never fully taking masks off, but simply, never taking masks off, but simply down for mouthfuls and back up again? Is there an emphasis on increased HEPA filters in this environment? So our elementary students eat with their cohorts and in designated seats. Students are permitted to demask when they are eating, and distancing is encouraged where possible. HEPA filters are deployed in all kindergarten classrooms and classrooms without either partial or full mechanical ventilation. And a summary of all ventilation improvements for every school is posted on the district websites. Each school's summary indicates the maintenance schedule, the status of filter upgrades, the frequency of filter changes, the air intake situation, and the number of HEPA filters deployed. Over to you, Dr. Klassen.
Thank you. The next question is, will our school boards plus our medical officer of health call on the province to update the School Pupils Act to include the COVID-19 vaccine as mandatory for students? As you may know, the Limestone Ontario School Board, which includes Kingston, passed such a motion earlier this month. So the Immunization of School Pupils Act does not make immunization mandatory, but it does require that students report their immunization status for several illnesses, including pertussis, diphtheria, measles, mumps, and rubella. In order to opt out, parents must participate in an education session, which will ensure that they have accurate information about Ontario's publicly funded immunization schedule and all the vaccines included. The legislation has been in place for many years, and it has led to very high vaccination rates in Ontario and in Huron Perth. The Huron Perth Public Health Board does support adding COVID-19 vaccine to the Immunization of School Pupils Act. Having the information on who is immunized allows us to respond quickly in the event of an infectious disease outbreak in school, such as measles. We can identify which students are susceptible and take appropriate steps to protect everyone. Having such information regarding COVID-19 vaccination status could be another tool to support local health units in providing more targeted responses to COVID-19 infections in schools in the future. Over to you, Mr. Rourke.
Thank you. So with respect to vaccination mandates, we defer to public health to provide direction on vaccination requirements for our schools. And back over to you, Dr. Klassen.
So those were the questions that we received most often and received ahead of time. I'll now ask our communication staff to share any questions that may have come up from the chat that we have not already answered.
Thank you, Dr. Klassen. So one comment in the comment section, 30% in terms of absenteeism, 30% in the high school is 420 cases. You will not notify until it gets to that point. Dr. Walsh, are you able to provide some information on that?
Sure. The 30% rule applies to all absences. So when when there's personal issues, when people are home isolating, or if they are sick, when we have bus cancellations and children can't arrive at school, those are all considered absences. So all of those tallies go into the 30%.
Thank you very much. Another question. Why do the vaccinated have a shorter isolation time of 5 days and the unvaccinated of 10 days when we know both groups of people can transmit COVID? Dr. Hayward, are you able to speak to the accuracy of that?
Yes, I can. So what this really comes down to is the immunity. So if someone is immune, and what that means is the immune system is this very fascinating, very complex, very smart collection of chemicals and proteins that can react to a stressor or a virus or a bacteria and basically eat it up, destroy it, and get rid of it so that the body can fight it, and also so that that person does not carry it and or be infectious once that immune system has taken care of it. So people can be immune either by vaccination or by infection to a variety of different illnesses. So the reason for the shorter isolation in someone who is vaccinated is that the immune system is going to be able to take care of that pathogen more quickly and more effectively, and therefore that person will not have active infection for as long as someone who's not immune through vaccination.
Thank you for that, Dr. Hayward. And continuing on the subject of vaccination, when will those ages 13 to 17 have access to boosters now that some are more than 100 days past vaccination number 2? Dr. Clausen, are you able to give some information on that?
Yeah, sure. So what I can tell you that NACI, which is the National Advisory Committee on Immunization in Canada, is currently reviewing the evidence on providing a third or booster dose to those who are 12 to 17, and they have not yet made a recommendation. And so generally the way it works in Canada is that Health Canada approves vaccines at the federal level. NACI, the National Advisory Committee on Immunization, does the scientific review and makes recommendations about how those vaccines should be used in the Canadian context, what age, what formulation, what schedule. And then the provinces make their decisions based on that. So right now, NACI has not come out with a recommendation for that age range, but I would expect that if NACI were to come out with a recommendation, then Ontario will assess that and decide whether to follow suit. That's how it usually works. Not every single time provinces can go out ahead, but in general, that's the process.
Wonderful. Thank you for that. And looking through, some of these questions have been answered in information that was already shared. We do have links for everyone to refer to as well. Dr. Clausen, if you wanted to wrap up for the evening with some final thoughts and words.
Yeah, thanks, Rita. So thank you, everybody, for joining us. I know that, we're talking about, your children, the most precious thing that there is. And that everyone really wants the best information and wants to make the best decisions possible and give their children the best possible childhood. And we really appreciate your flexibility, your patience, your kindness, and all the extra work that goes into, screening your children and trying to understand all this information and helping them learn how to mask and all the things that have been going on. It has been said, I believe that in-person learning is the essential work of childhood. And many partners, including your school boards and public health, are working together to ensure that children can continue to participate in in-person learning, which is the best way for them to learn. As you've heard, and for most children, I think there are some times that when that isn't the case, but for most children, in-person learning is the best way to go. As you've heard, there are many preventive measures in place, and we thank you for your support. Please continue to follow public health measures so that we can reduce community transmission and keep our schools open. Thank you, everybody.